So you are a holistic eye doctor. What does
Yes,
that mean?
it's a great question. So we have holistic and we have eye doctors. So if we break down the two terms, uh, holistic eye doctor, ophthalmology, obviously help people with eye conditions, right? People who are losing their vision, who are dealing with a whole host of eye issues, will normally go to an optometrist, ophthalmologist to help them deal with those problems. The holistic side of it comes from a place of understanding where most of these conditions are rooted in systemic issues. So, for example, people have diabetes that can create eye issues. People have systemic dehydration or taking medications that are dehydrating them. Maybe they drink too much Red Bull, too much coffee, they don't drink enough water, smoke too much weed, drink too much alcohol. So any of these factors that are going to reduce the amount of fluids in the body, for example, or factors that are going to drain their body, these are holistic understandings of systemic problems that are creating a symptom. In this case, an ophthalmic issue, an eye issue.
Right. And so you think that fluid is probably, at least it's like the lowest hanging branch
Yeah.
of what's wrong with people's eyes.
Yeah, for most health conditions. I mean, a lot of health conditions are a result of dehydration. We call these the macros: poor sleep, not exercising, crappy diet, dehydration, eating, drinking, consuming substances that aren't compatible with us, toxicity, so on and so forth. So
So what would you say if someone like drinks a lot of water throughout the day, but they still have like chronic dry eye? What would you recommend?
So that's a great question. So if we look at the tear film, people with dry eyes, for example, it's made of aqueous, which is water, mucus, and lipids, right? Fats. So if somebody's well hydrated, meaning like you're drinking now, some water, some mineral water, and they have the electrolytes, they have sodium, magnesium, potassium, that's going to help hold the fluids in their body, and their blood markers, and they're urinating clear. It's not like a dark color unless you're taking B vitamins. So we assume that they're well hydrated, but they still have dry eye. So is it a lack of tear production? Is it a lack of essential oils in the body? Do they need to eat more avocado, have some coconut oil, more fish in their diet, maybe take some omega-3 DHAs, things to bring more of that oil-based or fats or good fats into their diet that'll help lubricate the eyes. So again, it's this conversation of fluid, or we call thin fluids, and thick fluids, which are more like oils and fats.
Gotcha. So are you like an MD?
Not an MD. So I'm an ND, naturopathic
Gotcha.
physician. So I started my journey with acupuncture school. After college, I went to degree to get my master's in traditional Chinese medicine. Then I went further on to get a doctorate in traditional Chinese medicine. I have a doctorate in naturopathic medicine as well, and went on to study functional medicine. So most of my expertise are in the holistic functional field.
Wow. That's really cool. So, I mean, I know you're a big proponent of red light therapy for eyes.
Yep.
One thing that I definitely struggle with is like, I find like I've like used the Juve before, for example, and I feel like it hurts my eyes. Like I really try not to look at that thing. I don't like it. What's your take?
Yeah. So, I mean, there are things that in our environments that can strain our eyes. There are screens screens that we're looking at right now. And if you guys are watching on your tablets, on your computers, on your handhelds, your phones, they emit blue light, right? You need to protect your eyes from the blue light. There's not enough talk about this. When I first started practicing, I worked with a lot of different conditions, neurodegenerative conditions like macular degeneration, for example. So 30 years ago, when I started my journey on helping people see better and recover their vision, all my patients with macular degeneration were their 70s, 80s, and 90s. I see people in their 40s now with macular degeneration. And that's one of the main reasons is because of the blue light that comes off screens that we're on all the time, 10 to 15 hours a day for some people. And we're not protecting our eyes from the blue light radiation that's coming off screens that has a particularly damaging effect to the cone cells in the eyes that are where the macula is concentrated. So people are having eye issues a lot earlier, degenerative eye issues, because of the exposure to this blue light radiation, that our biology has not yet caught up to the technology of the amount of time we're spending in front of screens.
Right. So do you recommend red light therapy or no?
Yeah. So red light therapy is, we know the panels, those are good for whole body issues like energy, fatigue, like getting over viruses or infections. We found a newer use that it can be used for ophthalmic applications. And the eye doctors were into this probably about 3 years ago. They had started using it for dry eye, since we're on the subject. So conventional ophthalmology is already dialed in. I was at the Vision Expo in New York City a couple months ago, and they have they have probably 24 apparatus for using red light therapy for dry eye. So they're already using for that. We've also found that it can charge the mitochondria in the retinal cells in the optic nerve to help with a whole host of neurodegenerative conditions, as well as acute conditions like retinal detachments, accelerating recovery, eye strokes of the retina or the optic nerve, helping them to recover faster. So there's a lot of broad applications for using red light therapy for ocular disease.
So what would be like your protocol for?
Yeah. So it's actually quite simple. So I do not recommend the panels for ophthalmic use. They're too powerful.
Right.
Even say,
so I was right.
Yeah,
there we go.
Don't use those. There are glasses that we have, red light therapy glasses, that are much tempered. The frequencies there, it still falls in the infrared red light spectrum, but the power, the amount of energy in joules that's being emitted is not enough to cause damage. It's such a subtle amount that it's just enough to encourage the mitochondria in the retinal cells and optic nerve cells to start repairing and regenerating. So it's
kind of like glasses, but then there's just like essentially lights maybe around the frame.
So think of a red light panel in a glass. Yeah. So the red lights are kind of I wish I would have brought a pair with me, but they're basically on the inside, and you put the glasses on and they light up.
Can you see other things when you're wearing the glasses, or you just see the red light?
No. So it's just basically like a panel over here, and it's just like very mild red light. So you can see, you can see down, you can see up wherever you're not looking at the glasses. But the glasses, they have an LED battery that you hit, and then the light goes on. It's usually a 3-minute treatment, very, very fast. They're very affordable. The glasses are usually like $150. So,
wow.
They're cost effective. And we've had patients using them for the last year or two. We can't keep them in stock. Like we order that, we source them in. We've probably gone through about 2,000 to 3,000 people using them in the last like 6 to 8 months.
You sell them?
Yeah.
What are they called?
They're called eye-light red light glasses. So if you go, we're actually on back order now because we keep running out. But on our website, Eye Health Institute, eyehealthinstitute.com, you can see they're basically like a purple pair of glasses that have eye lights on them.
Interesting. Pulling it up now. So this is your website.
Yeah.
So there we are. Okay, cool. So $150. Transform. All right, cool. So that's cool. Is this like what's your take on like sun gazing?
Great question. Early in morning is okay. In the evening is okay. Midday, no good. The reason is because the UV radiations, they spike. And you can actually look online if you want to like grab your phone. There are apps, weather apps that I'll show you during the day when the UV radiation will spike. So like in the summer, for example, last time I looked was July 4th weekend. I was kind of hanging out with my friends and I was talking about like, oh, let's check it out. So that weekend at 9 a.m., boom, that's when the UV, so between 6 and 9, you're good. Don't need sunglasses if you want. You do your sun gazing. You could be outside without worrying about getting a sunburn. But it was amazing from like 8:30 or 8 to 9 o'clock. It was very low UV radiation. All of a sudden it spikes. So the UV radiation as well is a form of radiation that can create oxidative stress and damage the retina. When you're outside, if you have eye problems and you're exposed to the ultraviolet radiation.
Right. And so like, would you say that like a proper sun gazing protocol would be like, for one, don't wear glasses, right? Because we don't want to increase the magnification, right? So you want to take your glasses off. And in my expert like opinion, you don't want to look at the sun. You kind of
Nope.
want to look like off
Yeah.
and kind of focus away and kind of I like to change up my focus a lot.
Yep.
And
Yep.
once again, I'm only doing this when the sun is like very, very low.
Yeah. Yeah. Like dawn dusk. The best
Yeah.
time is like an hour or two after sunrise. But it's, so Mayor Schneider, a bunch of these guys, we're doing these protocols, the Bates method, stuff like that. But keep in mind too, that was created in the 70s when the ozone layer was definitely more intact. And look, man, I used to go out as a kid and I used to spend all day and I get like a little bit of sun on my shoulders. I can't go out for more than a half hour and I'm fried. So the sun is different. You know what I mean? So I kind of I like to talk about that and caution people. Like if you're not sure what you're doing, like get some recommendations from somebody who really knows what they're talking about if you're going to engage in these protocols. But for everybody, I think dawn and dusk, you're pretty safe.
Right.
And again, you don't want to stare straight at the sun because, not healthy, not good for the eyes. But again, looking off into the distance or dispersing your gaze where you're not focusing on any one central object, you're just kind of like taking it all in, so to speak.
Yeah, and I love what you said about how like the sun is getting stronger because of our ozone layer and all these things. So like one thing that I really struggle with is like I've definitely heard health influencers talk about the fact that like sunglasses are almost like crutches, and they actually make your eyes weaker. They make you more susceptible to burning. They make your eyes more susceptible to just not being able to handle the sun. But then at the same time, the sun is like so bright. So like I know like when I drive, I wear sunglasses just to protect against the glare. I try not to wear sunglasses when I'm just like making like outside for like 5 minutes, even if it's like in the peak of UV, like in the middle of the day. What's your take on that?
Say exactly what you just said. You're 100% right. So early in the day, fine. Sunglasses off, everything, is great. During midday, 10 to 4, at least 10 to 2, like you got to protect, especially if you're on the water. If you ski or snowboard or you're up in the mountains, you got the reflection, the UVB rays that are bouncing off the snow and water that can accelerate cataracts. So I think that getting sun exposure on your skin is really important, being out. I just don't know if I subscribe to that, to like if you're wearing sunglasses, I know all about that. Yeah. I don't know. I haven't really been sold too much on that yet. I definitely think sun's out. I think, you want to protect when the sun's at its strongest, for sure.
Yeah. Yeah. And back to, like the sun gazing and I guess like your red light therapy device. Do you have any like cool stories about people like maybe reversing macular degeneration? And also one more thing, can you also just define macular degeneration?
Yeah. So there's a lot of different conditions. I work with people with dry eyes and a whole host of eye conditions, but most of the conditions that I work with are optic nerve and retinal, macular degeneration, glaucoma, a condition called retinitis pigmentosa, which is genetic night blindness. So to answer your question, macular degeneration let's talk about the macula first. So in our retina, we have two types of cells. There's more than that, but photoreceptors are rods and cones. Your cones are in the center of your eye, called the macula. Even more concentrated in the center of the macula is called the fovea. That is your highest concentration of cone cells. Your cone cells are used for your sharp vision, your ability to read any fine detail, as well as color vision. So it's your central vision, your color vision, your HD vision. Your rod cells are more your grayscales in your peripheral vision, in your night vision, in your dark contrast vision. So like if you go from outside to inside, it's that ability to adapt. So what happens with macular degeneration is those cells in the center, those cone cells in your central vision will start to break down. Most of the time they break down because you have cholesterol that starts to accumulate and build up under the retina and the macula, which is called drusen. All right, so macular degeneration usually starts with these deposits, these cholesterol deposits under the macula called drusen. Over time, that will impair the blood flow to the eyes, to the retina, to the macula, and create degeneration. Reducing blood supply.
Do you know what kind of cholesterol is that?
So it's basically fat, protein, and calcium.
Like LDL, HDL?
It's a combination of both. It's like the same type of cholesterol that you'd find in your heart or your arteries, or amyloid plaque that gets in the brain. It's like that cholesterol, plaquey, fatty, same stuff that they find in your it's the bad fat.
So if you have a high cholesterol, you have a higher risk of macular degeneration.
Correct. And if you have thyroid disease, because if you have thyroid, you have a slower metabolism, you're not burning fat as well. So people with thyroid disease are more highly susceptible by 25% to get macular degeneration. So this drusen accumulates these fatty deposits, and that'll start to suffocate and starve the macular cells, and they'll start to break down and degenerate. And people who have that will start to see wavy lines, they can't read as well, facial distortions early on. As it progresses, you can't see anything. So it's like literally like that. You could see everything around you, but it's a big blob in front of you. So it really messes with people's lives. They can't read, they can't recognize faces, they can't work, they can't use on their phones. You need your sharp visual acuity to function, to work, to get things done. So it's a struggle when it advances, for sure. Yeah.
Eye stuff gives me so much anxiety, man. I don't know how you deal with it on a day-to-day basis.
Yeah. That's what I have to deal with. I deal with people coming apart at their seams, because a lot of conventional eye doctors don't have a filter, and they come in and like, yeah, you're going to lose your vision in 2 years, 3 years. It's like, how do you know? So it's like a death sentence. So these people come in a mess, broken, and they don't explain to them what's going on. So like, yeah, you have macular degeneration. They're like, okay, what's that? They go home, they're like, I'm going blind in the next couple of years, and there's no conventional treatment, no drugs, no surgeries, nothing they can do. So it's like, all right, what do you have? And they're like, nothing. Take some supplements, ARIDS, which is kind of vitamin A, selenium, zinc, lutein. That's the best they got. So these people are really on a doom and gloom, and they know things are just going to get worse. So it's very stressful.
And you'll put them on better diet, eye exercises?
Yeah. So it's holistic. So we have both in-office and at-home treatment programs for people. So people will come to the office. We do a whole series of vision testing before they get started to create a baseline, take them through treatment, usually for a week or two, very intensive. We'll do a couple of treatments a day, red light therapy, microcurrent stimulation, hyperbaric oxygen, acupuncture, supplements, eye exercises, molecular hydrogen, all this stuff to help get the environment in the eyes and the whole body to improve so their eyes can repair and regenerate, or at least slow the progression.
What's an example of an eye exercise that you do?
Yeah, so there's a couple. So there's near far gaze. So if you kind of look at your thumb, and I'm looking at my thumb now, and then I look at the computer, and I look at my thumb, then I look out there. So it's this near far gaze that's working the ciliary muscles on our eyes that actually, once people hit 40 or 45, they start to tighten up. And that's when people start like, they get readers and stuff like that. So those muscles will tighten up and the lens will start to thicken. So you can't flex the lens and refract the images. So that's why people get presbyopia, meaning nearsightedness. So other exercises work the six.
And how long would you do that for? Look at your thumb and then look at something far.
Like 9 to 10 reps. So I think working out, kind of do that. You can match it with your breath. So like an inhale, look at your thumb, exhale, look into the
I love that, matching it with your breath.
Yeah. So
do it in the cold plunge.
Yeah.
Breath work, cold plunge, eye exercise, boom, done.
Yeah. Just and to your point, having done all these, I'm a huge fan of stacking therapies, whether it's ice plunge, hyperbaric, breath work, all that stuff. It's the same. The work that I've done with cold plunging and all these other personal care stuff I've brought into my practice. And people are like, oh, well, I just want to try the acupuncture. I'm like, well, great. That'll work great. But if we add red light therapy, microcurrent stimulation, hydrogen, hyperbaric to it and stack the therapies, it's just going to create a better clinical outcome.
Do you have cold plunging at your practice?
I don't. I have it at home.
Right. But so you've never treated someone with macular degeneration with a cold plunge?
No.
Yeah.
But I do tell them, it's going to help with the vascular regulation, help with the stress, all the great things that come along with vascular regularization, autonomic, everything, all the good stuff we know about cold plunging.
Gotcha. And I do want to
not
touch
for everybody,
more on that.
But it's great.
Yeah. So, and right now you're wearing blue light blocking glasses?
Yes. Yep. These block out the blue light from the screens.
So, so the ones that I have are like they have like the orange or red frames.
Yep.
Do you? I mean, those the ones with the like red frames, they must work better, right?
Not necessarily. The technology's changed. So the reason it isn't because you can now get them on your prescription glasses. So when a lot of people, they don't want to have that tint inside. So the tint is a little bit old school. It works, but now they have like this purple bluish tint that they put on most glasses. If you go to your optometrist or optician, that's what they're going to create. It's a clear lens. And again, like on screens or stuff like that, you can slightly see a blue tint or a purplish tint, but they both work great. They're both
even at night.
Yeah.
Because like I just don't understand how like you were in clear frames, it could get rid of all the blue. Like there has to be blue light coming through. But like when I wear my what?
It bounces off the lens.
Oh, it bounces. But the image that you're seeing is still going to have blue colors.
Nope.
So you're really so like those frames right now. You can't see the color blue.
Nope.
Interesting. What do you see instead? Like
crystal clear.
Right.
Like zero tint. The ones you're talking about will give you like a little yellowish orange tint.
Yeah. And those ones like. Yeah, because like when I take because I wear like the red ones and I take them off and like it's like it hurts my eyes like because I'm letting so much blue light in. I just can't imagine anything works better than those.
Yeah, well, try them. I mean, you go to like PC Richards now, Best Buy, they all sell, even on Amazon, you're like $25-$30.
Right.
So just try them out. That's what I tell people. And to your point, there are different types of blue light glasses. There's the orange ones and there's the clear ones. People just do better with different glasses. So it's going to be a personal choice.
Is there a brand that you recommend for?
Not particularly. They're pretty standard.
Okay, cool. Have you seen this stuff about Ozempic and people going blind?
I have.
What do you think?
It's real. It's they cause NAION, which is an optic nerve stroke. You can get blood clots. Probably at least have a dozen people who've been on the shots and got an eye stroke as a result of it.
So it's not like something that's like happening over time. It's like a one shot stroke.
Yeah, it's a stroke, like a brain stroke in the eye.
Is it like sudden blindness?
Yep.
And then people can't recover?
Well, according to conventional medicine, there's no treatment. So you go,
and you're treating people that have gotten this stroke from Ozempic.
From Ozempic, also from COVID and the COVID vaccines.
Wow.
Yeah, huge. Never saw it. I saw maybe before COVID, if I saw an eye stroke every 2 years, it was a lot. It's the fourth most common thing I see now.
My anxiety is just spiking through this conversation. But so when you have an eye stroke, like what is it like your eye goes black?
Depends. It can be a partial. So if it's the optic nerve or the retina, it depends on what area. So you can have like the upper portion of your eye. You could have the lower portion. You could have the whole thing. You could have the central part. You could have the side. So it really depends on like your brain. You could have a brain stroke if it depends on where it happens. So it could be a small stroke, not going to have too much of a problem. You could have a grand stroke that'll affect a lot of your vision. Wow. So my first big case was actually an eye doctor from New York Eye and Ear Infirmary who hit me up during COVID. He had a bilateral eye stroke within 2 weeks. This guy's a top surgeon. And he called me up. He's like, we got nothing. I know who you are. I want to come out, get some treatment. So he was great because he educated me a lot. And we threw it at him. The guy it took about 2 years, but he recovered 80% of his vision.
Wow. And that was from the COVID shot.
From a COVID shot. Yep.
Wow.
Yeah.
I feel like I haven't heard about that. Are there lawsuits, or is that kind of just being brushed under the table?
So interestingly, if we're kind of going there, so I got canceled. My videos, Facebook and more YouTube. So ophthalmologists were the first to see the problem with the blood clots because blood clots they were showing microclots showing up in the retina. So ophthalmologists were like, what's this? They're taking pictures of the back of the eye like they usually do called the fundus image. And they noticed that some of these people were now having little micro blood clots around the time COVID came out. So there was some research reports that came out. I'm kind of, subscribed to a lot of that stuff. And I was like, oh my God, I got to let people know about this, especially people with diabetes, high susceptibility to high blood pressure or stroke or whatever. So I went on, YouTube, Facebook, and said, hey, look, if you want to get the vaccine, I'm not getting on a, soapbox about the vaccine. However, this is what you need to know. There's research came out showing that the clotting is real. It's showing up in people in the retina, especially people with diabetes, autoimmune conditions, other comorbidities. So just please be careful. And if you are susceptible to blood clotting or anything like that, just please be careful with this stuff. And here's the evidence that supports it. So that was the first wave, if you want to call it, of eye strokes. Then, the Ozempic and, all these GPL5 shots came out, and everybody's, not common. I'd say most people who do it aren't going to have any issues, but it's a risk, for sure.
Right. Right. And I guess it's sort of like the longer you're on these GLP-1s, the more your risk is going to increase as you age, right?
Yeah. Yeah, for sure. And it depends on what are your comorbidities. And the older you are, like, are you doing it at 30? Or are you taking the shots at 70? 65, 70, which there are people who do. So your vascular system is not the same between 30 and 60 or 30 and 70. So your blood vessels are more brittle, more susceptible to hypertension. So there's risk, but it works. So everybody loves taking them.
Yeah, I mean, it works, and who knows what. I mean, nobody knows the long-term consequences of this stuff. And
in my opinion, it's only a matter of time. Like, there's a whole bunch of, or there's always these drugs that come in. They're going to find some side effect or something that they're going to shut it down. But I'm surprised it's been going as long as it is. And look, if people want to do it, just that's their own prerogative. I don't judge that, but I do have a problem with people not being informed with what they're doing before they do it.
Yeah, and definitely, I think at the very least, like it could be used like as a tool to like kickstart that. If you want, like if you're obese, like it's possible, maybe, I don't know, that the benefits outweigh the negatives of just being like obese, and if you could just counteract that with the drug, then do it. But you have to find a way to come off that.
Yeah, one of my best friends from high school is a bariatric surgeon. He does a stomach staple, and he loved it. He said, look, there are a lot of people who are not candidates for this surgery. And these big people, who are very high risk for diabetes, heart attacks, all that stuff that comes along with being morbidly obese. So he loves it. For certain cases, he said, this is a godsend. But, you have everybody's and their mothers are pretty much using it now.
Yeah. It's crazy.
Concerning,
So back to like traditional eye stuff.
Yeah.
Like when you go to like a normal eye doctor, do you think that some of the diagnostics or anything diagnostically that they do is invasive? Like, for example, like I've always hated like when they check your eye pressure, that they're like pumping some pressure, some puff in there, and then I've heard now they're like actually like plucking your eye with something sharp. This can't be good.
Yeah. So what you're talking about with the eye pressure is called tonometry. So a tonometer is what checks eye pressure. So there's two types. There's a contact and a non-contact. So the puff is called the non-contact tonometry. It's fairly accurate within 2 or 3 points of the contact, which is a Goldman tonometry, which is a contact tonometer, which is kind of the gold standard. But they have to numb your eye first, and then they touch it, to get a good reading. It's all right. I don't have much a problem with that. What is a problem for a lot of my patients is the dilation. So in order to get a picture of the back of the eye or look at the back of the eye or get a good look, they have to numb your eye and dilate it, to dilate your pupils. So for a lot of people who have inflammation in their brain, their eyes, the central nervous system, they have photophobia, right? They have kind of inflammation in their brain or the eyes or whatever part of their condition. So dilating their eyes is going to allow a lot of light to come in. And these people usually walk around with like pinhole pupils because their body's trying to reduce the amount of light coming, can't take it. It's like if you drank too much, you have like a hangover, too much light will irritate you. So what happens is when you dilate somebody in a situation like that, it's going to be very, very, very disturbing to them. So most people, just kind of annoying. You get blurry vision for a little while, a couple hours, it goes away. But when you dilate some people, I mean, I've had patients that have reported permanent vision changes after being dilated because it was so they're so sensitive. They dilated, shining bright lights in their eyes. Their eyes were just so sensitive and so raw. It's like scratch it. It's like, start ripping a scab open. It's going to start bleeding again. So it's so delicate in there from the inflammation that you've just irritated it.
Yeah. Yeah. I mean, I just always wonder, like, I mean, think about all the times that I was just like 18 years old, like super healthy. And then this doctor's like dilating my eyes and just shoving some light down there and just telling me to like look past it. And it's like, dude, this fucking hurts. Like there's nothing, I'm 18. I'm healthy. Like, what are we doing? Like, why are we doing diagnostics for like healthy 20-year-old males?
It's a little atypical. I mean, if there's a family history of glaucoma, diabetes, if you got a reason to check it out, that's one thing. But typically they'll just do like eye pressure, check your reading prescription. But look, they bill for that. The more testing they do, the more they bill for. So there's that too. But typically,
one time I refused it, and like the eye doctor like got so mad at me. I think he like refused to see me. I'm like, I don't want to do the pressure. Like I was here 2 weeks ago. You did my pressure. Nothing's changed. Like what are we doing here? I was like, just bill my insurance. I don't even care. But just I don't need my pressure to get taken again.
Valid.
And then they also have that like that laser where you like have to focus on like a race car.
Yeah.
Even that, like I just don't. It's like I don't know. Like I don't need to do that more than like once a year.
You're right.
Once every 2 years.
You're
I don't
right.
know.
You're right. Every once a year, your age, teens, 20s, 30s, unless you see something with your eye, like, once you hit like close to 40 and you start seeing visual changes, you're having anything noticeable, you want to keep up on it, especially with the eye. Here's the other thing with the eye pressure, why it's important. When your eye pressure goes up, if you have glaucoma, you're not going to feel it. So they call glaucoma the silent thief of the night. Because your eye pressure can go up. You can go up for a long time and have high eye pressure that'll start to break down your optic nerve. And if you don't know that's going on and nobody's checked your eye pressure, you're going to go blind.
Wow.
So it is important to test it. But if you're checking a normal, seemingly healthy individual once a year, every other year, that's appropriate.
Do you are you in favor of like traditional medications for glaucoma, or are you more into like naturopathic ways of?
Sure, and I'll give you a perfect case example. I had some dude who came in 3 weeks ago, called me up, he's got glaucoma, really cool dude. He's like, I got glaucoma, my vision's going. He's probably in his mid-40s, and he's like, I stopped everything. I stopped taking my eye drops and everything. I was all right. So he lived pretty local. He came in, checked his eye pressure. Normal eye pressure is kind of below 20. Most people I see are between 11 and 16. This guy had an eye pressure of 102. One eye. Other eye, 54. That's a medical emergency. Get out. Like, gotta get out. So I told this guy, I'm like, you got two choices. You can start today. The second you leave, get back on your eye drops. I have to document this, or you got to go to the emergency room. You tell me what you want to do. So after 2 days, this guy's back on his eye drops, and we're doing our treatments to accelerate the dropping regulation of his eye pressure. Within 5 days, he was back down to 20s and teens in his eye pressure. So integrative, to answer your question, in the right doses, yes. For the right people, use eye pressure drops to drop your eye pressure. But glaucoma specialists are only focusing on your eye pressure. They're not focusing on the optic nerve, which is what breaks down with glaucoma. So they tell people, take your drops, or we're going to do a surgical procedure to lower your eye pressure, but people still go blind from glaucoma because it gives them a false sense of security that just because their pressure in their eyes is normal, their eye pressure, that they're not going to go blind. There are other factors like circulation, inflammation, oxidative stress, so on and so forth, that can create a hostile environment or unhealthy environment for the optic nerve. If you're not dealing with those additional factors, you're going to lose your vision. So conventional ophthalmology, glaucoma specialist, does not address anything other than the pressure for people with glaucoma, and it's dangerous.
Right. And you would suggest just cleaning up your diet? The nervous
Diet,
stop.
eye exercises, red light therapy, microcurrent at home for people who want to do that. If they want to come in for treatment, obviously, they come in, we work with them that way. So again, there's this at-home treatments that we coach people on what they can do. I'll do telehealth consultations with people, jump on the call and say, hey, I got this problem. I'll ask some questions to find out, and then I'll give them recommendations, supplements, home treatment, diet, sleep, exercise, just again, holistic. Like they're coming to me for their eyes, but their eyes are the access point as to what is going on systemically with their whole health. So I got to say, okay, tell me about your digestion. I'm here for my eyes. What does that do with my digestion? A lot. I'm not here for you to help me with my sleep. Yeah, but if you're not sleeping, you're neurodegenerating and you're going to accelerate your visual loss and the rest of your health.
Yeah.
So that's
I mean, it's crazy how people just don't think of the body as like a whole thing. Like they just like to focus on like one little thing, but like everything is related.
Right. Well, that's conventional medicine has fractionated medicine. And like when I grew up, I was a kid, I'm 53. Like I went to a doctor when I was 7. I cracked my chin open. This guy did eye exams. This guy did stitches. It was the one family doctor. He did everything. My brother broke his arm. He casted him and everything. So there's one pediatrician who did everything. So, and that was everybody who's a GP and knew everything. Now it's so specialized, which is good. But when the ophthalmologist says, oh yeah, you have diabetic retinopathy, you're bleeding and losing your vision and having all these problems with your retina and your optic nerve, but I can't deal with your diabetes. I don't know. You have to go talk to your endocrinologist about that. And neither one of them are communicating. So that's where I come in, because I'm kind of like, connecting all the dots and almost like a case manager for their eye doctor and their glaucoma specialist. And, or they have multiple conditions like, well, you have to go to the glaucoma specialist. The cataract guy deals with this. The optic nerve guy deals with that. Your glasses guy, your optician deals with that. So even in the field of ophthalmology, you got 10 different people who are not really connecting with each other or managing.
Yeah, I mean, it's a perfect case for like something that I say and a lot of people say all the time is you just have to be the CEO of your own health. You can't outsource 100%. That to someone else. You have to stay on top of it. And think of your body as an advocate.
And people are trained not to. And that's what happens. Like you said, you go to your perfect example. You go to your doctor and then you give an opinion like, why are you doing this? Shut up and just let me do what I'm doing. You don't ask questions. You don't question me. It's like this hyper authoritative, like, douchery that's like, it's like, dude, just like, I'm just asking questions.
One thing that I noticed too is I go to the doctor and every question I ask, the doctor takes one step closer to the door. So they're just walking out as I'm, and they're by my last question, they're just down the hall, like,
they're like bye. Right.
It's
halfway out the door.
It's absolutely crazy. So
and that's why part of what I do, people are dying for information and clarity and understanding about what's going on. And no doctors, there's not a lot, there's crap online. People, like you said, they freak out, they get kind of mixed information. So there's no person that they can talk to that's going to kind of bring it all together, show them what's going on. You're here. This is what can happen if you don't do anything. This is what you need to correct. These are the influencing factors that are affecting your condition. And you choose. I'm just going to show you what to do. If you want to do it, great. If you don't want to do it, great. It's your eyes, your health. But at least to give people a roadmap for what they can do to try to preserve and recover some vision.
Right. How bad is LASIK?
Not bad. I didn't do it. I was very close. Obviously, I wear glasses. I've had glasses since I was 4 years old. I used to be an 8, a +8. Now I'm +3, 2.5 to 3. So you've
reversed some vision loss.
A lot. Yeah.
Wow.
Yeah. A lot. I got rid of my astigmatism. So astigmatism's gone, and I'm probably about a third of what my prescription was when it was at its worst.
All right, let's hold the LASIK conversation a little bit. I want to know how you reversed. So first, how did you reverse the astigmatism?
Acupuncture. I actually did it, and I didn't know I was doing it when I was in acupuncture school. I went for my annual
What is acupuncture?
So you put in little needles and acupuncture points, neurovascular junctions that helps regulate body processes. So think of your switchboard at your electrical panel at your home. You have different switches that turn off the kitchen, the living room, the basement, the garage. So that's what acupuncture is like. You flip little switches that send signals to your brain that says, turn on the functionality for your vision, improve function for your digestion, help you to breathe better, regulate your heart rate, reduce histamine for allergies. So it's a way to regulate the body's processes by stimulating neurovascular junctures or nodes called acupuncture points where nerves and blood vessels intersect to send a signal to the brain to regulate a hyperactive process that's going on or a hypoactive fatigue process that's going on.
Wow. So, okay. So basically that's acupuncture. So you just did acupuncture and that fixed your astigmatism.
In school, I knew I had my eye stuff. So I started doing a lot of stuff to release the tension around my eyes. And look, when I went to acupuncture school, the desktops just came out. So I'm never used computers before. I'm dating myself, using like Smith Corona word processors. Now I'm on computers for, 8 to 10 hours a day during assignments and papers and research. And my eyes, I was feeling it, from being on screen so long. So I started doing some acupuncture and I went back to the eye doctor. It's like, wow, you used to have astigmatism and your prescription's actually better than it was. What are you doing? So he's a young guy, and I'm like, I go to acupuncture school. And he's like, that's all. I saw that we're in San Diego, so a little bit more open to that there. And so that was I didn't really know. I figured it was just going to help with my eye strain, but I didn't know that I was going to have that big of an impact. So his third-party confirmation was like, oh shit, we got something here.
So it did both the astigmatism and the vision correction in one shot.
So then I started learning about eye exercises, the Bates method, started learning, kind of triggered me to learn as much as I could about this and help people that like I said earlier, a lot of these conditions, conventional medicine doesn't have any help for.
Wow. So if someone wants to heal their vision with acupuncture, how often would you have them do it?
It depends. So a lot of times people just need to do acupressure, which is eye exercises. And I have a whole video series on that. Again, it's kind of the stuff that we were talking about earlier, figure 8 exercises, near far. You can hit acupressure points like your temples, the back of your head around here. Just find some tender spots. If you've been on your screens a lot, you'll definitely find some pressure points in the back of your neck here. You'll find your temples are pretty jacked up. There are pressure points under your eyelids. So I have people massage, under your orbital bones over here. Really useful for that. And just kind of poke around and find any, hot spots, under your eyes. You could go under as well. Massage that. So you want to get all the blood flow and all the muscles to relax around your eyes, because just like every other part of your body, you have muscles that innervate your eyes. The movement of your eyes plus the constriction with the ciliaries, they will get tight over time. They will get tense. They will lose their flexibility like every other muscle and joint does as we age.
Okay. You still didn't answer my question. How if someone is looking to heal
acupuncture?
Yeah, what do you recommend?
I usually have people come twice a week and we'll supplement that with eye exercises and eye massage.
Okay, cool.
Yeah.
Cool. Great. Are you familiar with the meridians and how each tooth maps to like a different organ system?
Yep.
And so there's like 2 teeth that are directly mapped to your eyes.
Yep. The liver points, the liver ones.
Do you think there's something to that? Have you seen like people with tooth issues with the tooth that's specifically connected to the eye that they're more likely to have eye problems?
Yeah. And specifically, so let's unpack that for a minute. So in Chinese medicine, there are meridian systems and there's microcosms, right? So there's the ear is a microcosm, the hands, the tongue, the eyes, iridology, the teeth, the navel. So there are all these microcosms in the body. So we can look at that. Say somebody has an eye problem. We could look at the teeth, we could check the pulse, look at the tongue. So we're looking for patterns. So just because somebody has like an eye issue and a tooth issue on that tooth, that's not enough. We want to go deeper and say, okay, let me check the pulse. Let me look at the tongue. Let me ask other questions. There are other liver-related issues that are usually what is underlying eye issues when we're looking from a Chinese medical perspective. So those points you're talking about, or those teeth rather, that relate to the eyes actually relate to the liver. So people could grind their teeth, they could have bruxism, or they can have a tooth infection or get a tooth out, and that can relate to an eye problem. Perfect example is I've had some patients who've had a root canal in a specific tooth, and I've had one case that had that. The tooth canal went bad. It got infected from the root canal, lost vision as a result of that. Now, with that said, how far is it from the from the eye to that origin of the tooth? So you're also talking about a local festering of bacteria with about an inch difference between the gum line to where the tooth is to the eye. So you're also in close proximity to that as well. So,
but I have seen those charts where they show all the nerves that from the teeth connecting throughout your entire body. So that freaks me out a little bit.
It's a mapping. Again, so in Chinese medicine, we map like these different, it's very similar to the nervous system and the circulatory system and the lymphatic system. These longitudinal channels which mimic the nervous system and the circulatory system and the vascular system. So again, you can influence it. Same thing with the ears. So there's different eye points around here. It's like an inverted fetus. Right? If you think of fetus, the head is here, the spine is here, kind of curls.
I never thought of an ear like an inverted fetus, but I love it.
Right. So in Chinese medicine, the ear, so you treat that. Like if somebody's got back pain, upper back, mid back, lower back, headaches, eye problems up here, hearing problems, sinus problems will go in here. So we palpate. Is this tender? If it's tender, that's an active point. We treat it, and that'll often neutralize some of the symptoms people are having.
That is so cool.
Yeah. That's why I got into this. I went and checked it out. I was like, this is so cool. I saw a guy, my first experience watching acupuncture was a guy who had frozen shoulder, and I followed an acupuncturist. I was kind of shadowing him, and he put a needle in this guy's foot and actually his lower leg, and this guy couldn't move his arm, and he starts just doing this to the needle, and he tells the guy, he's like, move it. He's like, I can't move it. What do you want? You understand? I told you I have frozen shoulders. He's like, well, humor me, try to move it. Guy's freaking out. He's just stimulating this point in his leg, and his arm's moving, and he's starting to do this. I was like, that is really cool. I have to learn how to do that.
Wow.
So, it's very fascinating, and it's the problem with a lot of this is acupuncture came in the 70s and 80s from China, got really popular outside of the Chinatowns. But it's been so not investigated. So it has this like woo, like kind of airy fairy kind of like air to it. It's kind of like non-medical, but it's very medical. If you understand it and you do the research around it, there's an enormous biomedical understanding of acupuncture and how it works. It's just people get so caught up in like the meridians and the chi and the energy and the it's kind of done a little bit of a disservice in like this alternative medicine. In China, mainstream China, every hospital has acupuncture. You
really?
Yeah. So you go if somebody has a stroke, they get stabilized. They're right to acupuncture the next day. And they have
like an MD in China knows acupuncture.
Oh, yeah. Yeah. So you go to med school and then you could branch out and with specific industries. So you have acupuncturists who specialize in orthopedics. Acupuncture specialize in pediatrics, stroke, fertility, whatever the problems are, ophthalmology. So there is a holistic specialization. So start at, basic med school, and then they'll go for kind of mainstream conventional surgery in pharmaceuticals, or go like acupuncture and herbs. And then they'll kind of cultivate that practice as well and start learning acupuncture and other techniques.
Wow. My mind is just being blown right now.
Yeah. It was
because I always heard about like Chinese medicine and stuff, but I kind of never. And I'm always been such a not a fan of our Western allopathic medicine, but I never really like took the time to really learn about like what they did in China. And I guess I didn't really put together that it was acupuncture that they're doing over there
and herbs. So inside that, you'll have a track where once they'll choose the like non-traditional allopathic medicine, non-biomedicine, they'll go and they'll usually split to either an herbalist. There's these master herbalists it's crazy. They will sit, feel your pulse, write out a prescription, send you down to the hospital basement, get your, 3 to 6 months of herbs. Then you'll go get your acupuncture. Then you're going to go get your cardiovascular evaluation and your MRIs for whatever, you know what I mean? So it's so integrated over there. So we're pretty behind. America's actually pretty behind. Right? Europe has a lot of that as well. America's like one of the
Europe uses acupuncturists?
Oh yeah, in the hospitals.
Wow.
Yep.
I wonder if that's why we see China as like the enemy, like the CCP. Like we don't want like our citizens talking to their citizens as much, and kind of like understanding what they do.
More so recently. So there was that, in the 70s when Mao Zedong was kind of doing the revolution back there, and then things were opening up the trades. But obviously the last decade things have heated up a little bit with China. So there's been this closure, but. Chinese medicine is very powerful medicine. It's not a cure-all, can't help everything. But like I was saying earlier, you get a stroke, like they don't really have much for you. Let's send you to occupational therapy, maybe put you on antihypertensives and cholesterol meds. You go after a stroke in China, you're every day getting acupuncture, sometimes twice a day. They'll throw needles in your head. Their families helping them out. They'll take the needles out when they get home. They have like a 90% recovery rate from stroke. In the States, it's like 20%, and they don't do anything, just send you packing. Wow. So it's just a lack of implementation and understanding and openness, as you just articulated, to seeing what else could be complementary.
Yeah, it just doesn't seem like our brightest minds are doctors, and they go to med school, and it just doesn't seem like. How come they don't go outside of the system at all? Like it's like they're taught this one thing, and these are the brightest. The smartest people in this country, like holistically, are doctors, and it's like they have no interest in learning this. Oh, it's woo woo. Like, well, why? I mean, China has how many billions of people? They do this. It's not worth looking into at all. How many years did you say?
It's 4,000 years of documented, empirical.
And how old's our country? 300 years,
yeah, right.
200 years, So, but we have it. We have all the answers. We're the Americans.
There's a lot of ego, and I have a lot of friends who are physicians. I talk regularly about them. So there is a level of indoctrination. There's like this kind of you're a doctor, you're MD medical deity, but also to their defense. They can get sued if they recommend anything outside of the industry standard, their box. Right. So if they recommend acupuncture and they go to somebody who's not trained and they do a pneumothorax, they, do a point here or something and they puncture a lung, the doctor can be liable. So they're like, look, this is what I do. I don't know anything. There's a lot of egos around, but my friends who I talk to, they're like, we have, it used to be do no harm and help your patients. Now it's CYA. That's the number one thing that, doctors really have to concern themselves with, not getting sued and not losing their license.
What's CYA stand for?
Cover your ass.
Cover your Nice. Quick question. We don't have to really get into it anymore, but I'd imagine acupuncture is not covered by insurance.
It depends. It is covered by some policies. So it really depends on the policy. Some will pick it up, mostly for pain.
Okay. All right. Let's go back to LASIK.
So LASIK, the reason I wasn't too into it is because I found out pretty early that for most people only lasts for 10 years and then you need glasses again. So I was like, okay, 10 years. And I was fine back then using contact lenses because I was surfing, snowboarding, doing martial arts, all my stuff back then. So I was fine with contact lenses.
But inherently you don't think it's that bad?
No, nope, not at all. Sometimes people get halos. The one thing I will say about it is some people will go into LASIK with dry eye and they don't screen people before they get LASIK. And if you have dry eye before you get LASIK, you're more susceptible to having irritation, the halos and stuff like that. So if you're thinking about getting LASIK surgery, definitely if you have any dry eye issues, handle that before you go in.
Amazing. Well, we got the high anxiety for me part of this interview done. I'm done talking about eyes.
Got it.
So yeah, let's just hear. So it's pretty cool. You're eye guy, eye doctor. You're into cold plunging. What's your protocol like, and how'd you get into it?
So since we're a cold plunging podcast, I'll tell you it's a pretty good story. So always I was very, very thin. Like growing up, like very, very cold sensitive and everything like that. So I have 3 boys. My oldest is 22, middle guy's 21, youngest is 15. So we go to the beach, right? Young kids, we're in Jersey, go to the Jersey Shore and go to the pool, town pool, and anything under 75, I was not getting in. And it got to the point where I was like, Dad, go to the beach. It was like 65 degrees in the water in May and June. We're going in. All right. Standing on the edge. So it started to get to me. I didn't really make it an issue, but I'm like, such a wuss with this cold water thing. So in 2017, I went to a men's event, right? A businessmen's kind of retreat. And one of the things that was done there was, we kind of did boot camp and stuff like that. We're kind of military, Navy SEALs type stuff, and they're hosing us down. It's freezing cold. Then and I'm freezing. I'm already out 2 hours. I got no body fat and I'm freezing. Then they pull out the ice baths. And I immediately was like, oh, I'm going to die. Just knowing that this is my worst hell. So for me, that exposed the weakness. So the hell of that experience, I was I came out from that week event, I'm never going to I have to figure out a solution to deal with this cold thing because it was not acceptable. I was raising my standard. I'll use different words, but I wasn't going to be a wuss about cold water anymore. So I started research and I learned about Wim Hof, right? At the time, about, 8 years ago, he was kind of the main guy who was doing this stuff. So I followed his protocol. My youngest son was 4 at the time, and he did it with me. So we did these series of cold showers, the breathing, the stretching, and then we finished, I don't know, it was 10 weeks or something like that we got a big tub, put the ice in it, dropped it down, and we're okay, we're going to time it. And we're together, I'm in the tub with him, and we're just getting so fired up, watching the timer, how much I'm not going to get out, you can get out. So that was my turn. So now it's anytime I see cold water, we went to a wedding at the Jersey Shore, water was I don't know, 62 or something like that 2 weeks ago. I'm I'm in. You're in? I'm I'm in, dude, So I love it. Cold showers every day. Still do the breathing, the stretching, a lot of the Wim Hof stuff, but super advocate for cold plunging, and it's absolutely a part of my life.
You still live in Jersey?
Yeah. We live in a town called Warren. My practice is in Westfield.
In Warren. Okay. That's a little central-ish?
Yeah, Central Jersey.
Okay,
exactly.
Cool. Yeah, I'm in Seabright down here.
Oh, yeah. We're down in Maniloking. We have a beach house down there, so
oh, nice.
Close to you.
Yeah. Maybe we'll have to do a cold plunge.
Absolutely, dude. Yeah.
And I may have to come in for some acupuncture.
Yeah, dude. Come up anytime. Absolutely. Happy to show you around, give you, a session, introduce you to the world of acupuncture, and we'll hang out.
Yeah. And as far as do you have a cold plunging protocol routine now, or is it just
I do everyday cold showers, which is as cool as you can get. I'll do my regular shower, and I'll do a couple minutes cold at the end, and we do cold plunging at home, and in the winter.
Do you have a cold plunge?
Yeah.
What do you have?
One of the little white porcelain. I can't remember the name of it right now,
nice.
But it's got
acrylic.
A legend and everything. I started with the tubs, and I was putting ice in it. It's 5 years ago. That got old. I just kept it outside. I was kind of hammering it, and we have a spa, so I figured to kind of keep it next to the hot tub. So now I like to do the hot cold, go back and forth, hot tub, cold plunge, hot tub. So I'll do that as well. And then we have some trails that I take my dogs out, that we have some rivers and brooks. So in the winter, we'll all get in the water, and I'll kind of strip down, and we'll sit in the rivers and brooks, and they'll jump around because they're Portuguese water dogs, so they love the cold water. So they kind of push me.
So you have some freshwater rivers right here in New Jersey that you could swim in.
Yeah. I mean, they're kind of streamish. They're not. I wouldn't.
It's not gross. It's not bad water.
No.
Okay. No. I just never know what water I can jump in, and it sucks that we live in a world where you have to worry about.
If there's a carcass upstream, there's bacteria or something like that. But still water, a little, like a reservoir, but there's a lot of lakes around here. We could do that. But there's a lot of, we live in Warren, so there's a lot of mountains and not really mountains, hills. So we can find a lot of places that we can slide in and, do a little, even if you lay back and you just get, some cold coming over you for a little while over your head. It's so super awesome.
Yeah, definitely. Cool. Do you have a hot take for us?
The hot take is yes. You mentioned it, so I'm going to echo yours. Be an advocate for your health, whether it's eyes or anything else. Do not I don't want to use, I was going to say, don't trust your doctors. Do not rely on them 100%. It is not the end all be all. What they say is guidance and it's an opinion. It is not the absolute end all be all of what is and what should be. Conventional medicine is one part of the entire system of medicine. Conventional drugs and surgery is a section, is not all of medicine. So if you're dealing with a health issue and you're not able to figure it out and you need help, go do some research on your own. If you need help, go ask for it. A lot of these conditions people have, you don't deserve it. You weren't cursed. You didn't create it. You're not responsible. You didn't ask for it. But it is your responsibility to deal with it, manage it, and figure it out.
Amazing. Where can people find you?
iHealthInstitute.com, YouTube, Dr. Andy Rosenfarb, Facebook, Dr. Andy Rosenfarb's AccuVision community, TikTok, we're pretty much everywhere.
Amazing. Thank you so much. This is the Cold Plunge Podcast with me, Mike Gorman. Be sure to check out the video version of this podcast on our YouTube channel and check the show notes for any references, studies, or links to anything I spoke about on our website at plungereviews.com/podcast.